Hi, my name is Richard Finn. I'm a myofascial trigger point therapist and a licensed massage therapist. What I'd like to do today is showcase for you the effects of the O2 Derm Relief gel. A little bit of dab of gel in the right area can make a huge difference in most people's pain complaint, maybe even yours. Let's get started.
But the biggest issue I have is stenosis, and I have reduced the problem of that by rebuilding my back muscles.
Okay.
But my problem is we travel a lot.
Okay.
And I don't have the same equipment. So I might go 3 or 4 weeks without it.
Okay.
And I notice then sometimes I get some tingling and the usual stenosis reaction.
Let's let you have a seat.
Okay.
First thing I'm going to do is I'm going to kind of bounce the shoulders don't have any bounce. I'm not going anywhere. Now what I'd like to do is turn your head and see how far I go. Oh, is that all you're giving me, sir?
Yeah, doesn't go any further.
That's it, okay. All right, now what I'd like to do is have you punch your thumb down for me. I'm going to pull your arm out and see how far that goes. That's where you stop, right there. And I want to bring it up here. Okay, and we're right here. We're basically level with your ear at this point. Now I'm going to put this palm right here. Ooh, is that as far as you bend? That is as far as you bend, sir. We can't put that palm flat down at all.
Yep.
Okay, thumb down. Okay, so like I said, there's a very, very big difference between these two sides. Now let's turn the thumb up. Let's see what happens here. This one, on the other hand, seems to be pretty much the same as the other side. And then we'll bend the elbow and bring that palm up. What I want to do is I'd like to put a little bit of gel on the back of his neck. Again, just a little dab over here. I don't use a whole lot of gel when I do this, but I want to put this at the lower part of his neck because this controls the nerve supply going down his arms. Okay. Now, with having done that much, let's see how his head's doing. I think that's a little easier for the turn, but let's see what happens with this arm. Thumb down.
Wow, amazing.
Okay. That looks a whole lot like the other arm does right now. Let's turn the thumb up and come back. Now that's way behind your ear. You didn't do anything like that before. Yeah. Now let's bend the elbow. Let's see. Okay, I still can't touch that, but that's something. Now let's see what happens over here. Turn that down, bring it across, and again, we did really well before, but now we're doing even better.
That's amazing.
Notice how hard I worked to make that happen.
That's amazing.
Okay. This is not limited to my abilities. This is something you can do for yourself with the gel. Now what I'd like to do is treat the fingertips in order to have more of an effect going up the other direction. Can be really effective. And these, again, some people consider these to be acupuncture points, and other people just say, well, hey, it's the end of the nerve. I don't really care which it is, as long as I get a change. Okay. At this point, notice that you're starting to bounce a little bit. Okay?
Yeah.
Which is nice because you didn't do any bouncing before.
Yeah.
And I don't know if we're going to get anything, but look at that.
Wow.
Even with stenosis, we can get a little bit more motion.
Wow, that's amazing.
Up here. And I want to put a little bit of this right on here on your bicep, because this part of your bicep pulls on your shoulder and sometimes has an effect on the flexibility of your...
I've talked to doctors about this. They basically say, well, the only thing we can do is to go in and do major surgery and metal pieces in and screw all the vertebrae together and to separate them and all that stuff. And I've seen people have that done who ended up with no motion. And this is extraordinary.
Dude, what are you doing over there? I thought you couldn't do that.
Oh, I couldn't.
I thought you had stenosis.
Yeah.
Okay.
It's amazing.
We put a little dab of gel. We saw huge changes. This should leave you with some questions, like, what can this gel do for me? Get some gel and find out.